Okay, so I'm working on that. Hope to get that to you soon. I am also working on groups for your week 7 assignment. Hope to have that to you today in the next couple of days. Everybody knows what I'm talking about, right? We'll go through that in the module. Okay, so I'm working on groups, study guide. Let's see. Okay, today I'd like to go over, before we get going on this week's information, I'd like to go over the quiz. A lot of people, a lot of students miss questions. So the one thing I can't figure out from yesterday's group is when you guys submit the quiz, I'm not sure why you're not, you just get your score. I don't know why you're not getting your wrong answers and being able to understand. Is that correct? You guys don't get your answers of what you got incorrect. That's why I want to review the quiz. I don't want to pull up anybody's quiz.
Yeah, we don't.
Pardon me?
No, I was just saying we don't get to see them. We don't know what we got wrong or anything.
Exactly. I am going to our curriculum meeting tomorrow, and that's on my list to see if I can try and figure out what's going on there. Okay. I'm just reminding everybody.
I have a question too.
Go ahead.
I have a question.
Yeah, go ahead. I'm just, if you're not talking, if you would mute yourself, that would be great. Go ahead.
It's not timed for the quiz.
Pardon me?
The quiz. Tasha, you can unmute. Tasha.
Go ahead.
I'm sorry.
I don't know where all this background noise is coming from.
Yes.
Okay.
It's about the time. It's not timed. The quiz, it's not timed. Like you can spend more, 1 hour or.
Okay. I thought they were supposed to be timed. Okay.
No.
Okay. Great. Thank you for pointing that out. Appreciate it. So we'll review the quiz. We'll review the quiz before we get started. Okay. What else do I have for you guys? I'm going to set up the exam in the next couple of days so that you'll be able to download it. Obviously, I sent you the email about all the expectations for exam taking, meaning that your exam needs to be, you have to download it before the exam. Everybody knows that, right? Okay. Does anybody have any questions about any of the announcements that I sent this week? Okay, Tasha, I think I'm getting all the background noise from you, so I'm going to mute you. Okay. Okay, let's go into the modules. I want to go up. I want to, in this week, you didn't have any readings in the book. It was all on your resource pages in your module. Did anybody notice that? Okay. Tasha, I want to show you this right here. Here's your med-surg conversion. Okay, and it's in your student resources. It's set up just like that. So you do have all the books are been sorted out. Everything's correct. This is your conversion guide. There's not much on it, which is a good thing. The shorter the conversion guide, which means less has changed. Okay. Anybody have any questions about that? In week 7, some of you guys were looking at me funny when I mentioned the group assignment right here. Week 7, your group project. Okay. So you'll be picking an infectious disease. You'll be presenting it during week 8 class. You have to submit a paper about it. Everybody submits it. Okay. We'll talk more about that, but I just wanted to, that's That's your group project. So that's what I'm sending group assignments for. Okay, and there'll be more instructions coming from that. The one thing I did want to cover, because it came up in yesterday's class, somebody asked me, because it's in our week 3 module, begin working on vulnerable populations. Okay, that came up here. So I just want to review that. Okay, has anybody taken a look at this? This isn't due till week 10. However, this is not a assignment that you start in week 9. This is kind of a research project. So what you need to do is you need to pick a vulnerable population in your own community, in your zip code. Okay, something you're interested in learning more about. Homelessness, substance abuse, teen pregnancy, elderly, kids, vulnerable populations. Okay, and so don't I don't want to get a paper that tells me about the homeless population in the United States or the teen pregnancy rates in the United States. This is specifically a research paper for something directly in your community. Okay, and then you'll be doing a windshield survey. Okay, what's a windshield survey? You drive around, you walk around, you ride the bus, and you ride around the community to identify a vulnerable population. Okay, then you conduct research on your chosen population, internet, calling the health department, visiting the local health department, interviewing people, whatever you choose to do. All right, and this is a PowerPoint presentation. Okay, it's pretty laid out for you here, what you need to do. Complete your windshield survey. You're going to be identifying the population in detail, identifying health risks and needs of that vulnerable population that you choose. Okay, resources that are available, and then the gaps, what's not available and should be. And that's presented in primary, secondary, and tertiary examples of service gaps, then summarizing your findings. So prepare your PowerPoint. Here's how you'd file it or save it. Here are some suggestions of vulnerable populations. If you choose to do something other than this, that's a vulnerable population in your community, that's perfectly fine. Perfectly fine, whatever you're interested in. Okay, and then down here is it really kind of gives you a template. Okay, so I have a lot of students just use these 3 or 4. The one thing that I need to add in for next term is there is a 5, and the 5 is a summary right here. Summarize your findings for each of the different categories. So it's kind of an overall summary at the end of the paper. Okay, so a lot of students just use these headers at the top of their slides so that they stay on task and make sure they get all the information in those slides. Okay, so population description tells you what you need, gives you 2 bullets, what you need in those slides. Health risks, two things you need. What are the resources? What are the gaps? And then the 5th one is the summary, and I will make sure I remind you of that. Okay, and then here, look at the rubric, okay? Because it tells you what you need to have. That's how I grade it. Okay, your population, your health risks, okay, service gaps. Okay. So like in the resources, if you want 8 to 10 resources or 5 to 7 or less than 5, that's how it's graded. All right, so always, and that goes for any assignment, always look at your rubric. Okay. Anybody have any questions about that? I know it's early, it's week 3, it's not till week 10, and you're probably not going to think about it, but I just wanted to kind of plant that seed that will be due in week 10. So,
No questions.
okay, great. Okay. Let's go back to this week. Okay. So your readings were these teaching pages on we're going to cover migrant farm workers and rural populations, homelessness and poverty. As far as your NCLEX questions, I can't accept screenshots. Okay, it has to be a PDF, and that's the university's rule. Can't accept screenshots. So make sure that you are sending the PDF. Okay. Make sure you're accessing this assignment through the module link. Okay. Because if not, you're not going to be able to submit it as a PDF, and that's how screenshots come up. If you need help troubleshooting, you need to go to your student resources and check in with Evolve and find out what's going on. The other thing that's critical is I need you to request one batch of 50 questions with the current categories. Everybody knows where to find the categories, right? They're right here. Okay, so this week, here's what you select. Okay, developmental stages, pediatrics. Okay, so that's your content area. And you need to submit a batch of 50 questions. I don't do 2 25s or 5 10s, because you're not going to get the full effect of all of these content areas. Okay. The other thing about NCLEX, I'm not sure if you guys know this, you should, but you know that you can do NCLEX as many times as you want, right? Okay. And why should you try and get up to 50?
Because it'll help you with, it'll just help you when you actually take the NCLEX exam.
Exactly.
It teaches you how to take the test taking strategies, basically.
Mm-hmm. Yep.
I have a question. Like, after we do the NCLEX questions, do we have to do remediations for the ones that we miss?
Nope. But here's why I would think that you would want to do NCLEX until you get the highest grade, because once you do an NCLEX and you get questions wrong, you get all the rationales. And I am a firm believer of rationales being a really, really excellent learning tool. Okay, so redo them, read the rationales, redo it. That's how you're going to learn. Okay, if you submit a grade of like 30s, I'm going to grade it, put a 35 in your grade book, but I'm also going to send you a message saying I've reopened it for you in case you want to do it again to improve your score for learning purposes. Okay, so if somebody's submitting something in the 30s, they probably haven't learned a whole lot from that assignment. Okay, and you can just keep doing it, and then just submit your highest grade. But the purpose is learning what you got wrong, learning why you got it wrong, and what the correct answers are. So does that help clarify NCLEX? If you're submitting a 49, high 40s, 50, then I know you understand all the questions. Okay, but if you're submitting something in the 30s, I don't know what's going on. You've either rushed through it or didn't take the time to read the rationales. And then when I reopen it, that's optional. That's for you guys. That's not for me. That's for you guys. Okay. Any questions on NCLEX? I have somebody who just came in that it just says student. I don't know who that is. Who is registered for a student? Do me a favor, everybody that's come in, if you guys could put your name in the chat. I am going to start taking attendance via chat. I've had some issues with students saying that they were here and I didn't have them. So I didn't have them checked off in attendance. So if you guys could put your name in the chat, that would be great. Let's see, what else do we have to cover? You have another quiz this week. Looking at next week is exam week. So what I'll end up doing is doing a recording for you for week 4 material and send it out next week or over the weekend when I get to do it. Okay, so you'll get your week 4 notes over the weekend, and then I'll do a recording. Okay, so and then next week is exam week, and everybody knows your exam. This class exam will be at this time. Okay, Tuesday morning. Okay, any questions? Let's go over quiz 1. And again, some of you got 10, some of you got 9s, but some of you didn't. And so I want to just talk through these 10 questions to make sure you understand. So hopefully you'll remember what you checked and which ones are incorrect, but I'm going to try and get that fixed. Okay, so this is interactive, so let's all participate. What's the correct answer here? Number 1, which is an example of community-based nursing practice. First of all, what's the difference between community-oriented and community-based? We went through this in week 1. I know it's early, but got to participate, please. I don't like calling on people either, so please jump in. For the exam, you have to know what the difference between community-oriented and community-based is. So what is it?
Is community orient is based around the community or the population. The primary focus is on health promotion rather than illness cure.
Yep. So that would mean, Tasha, that community-based is what?
So maybe like for the answer, is it the pregnancy prevention program?
That would be community-oriented. So the correct answer is number 2. Educating a child and school teacher on the use of inhaler. Because remember, community-based nursing, I remember it as you're based in the community. You're already working with clients, okay, for illness prevention. Okay, we're community-oriented. You're looking at the whole population, like Tasha just said. So educating a child and a school teacher on the use of inhaler is an example of community-based. You're based in the community. You're performing education with a student on the use of an inhaler. All the other 3 are community-oriented. So you're looking at the community as a whole. So developing a teen pregnancy prevention program, right? That's community-oriented focus, right? Evaluating the outcomes of a vaccination program, that's community-oriented focus. Okay? Do you guys understand that? Okay, question 2. What's the right answer? Part of your assignments in week 1 was to peruse through the Healthy People 2030. What did you guys come up with?
Is it one? A.
Okay. Okay, and A is the correct answer. Okay, provides a framework to improve the health of all Americans, just like Healthy People 2020. That's their goal. Okay, number 3. What's the correct answer at number 3?
Is it 3?
No, it is number 3. Why is it number 3? Why?
I said it was 3 because since they are uninsured, they are more likely to be diagnosed with diseases because they aren't going to doctor's appointments as they should and getting that preventive care to reduce the risk of getting diseases and
That's
illnesses and stuff.
exactly right. Yep, that's exactly right. Okay. Uninsured, underinsured, there's an issue with access, right? So a lot of times they don't get diagnosed till it's more of the disease is more advanced. So that is the correct answer. Question 4, just to clarify, when this populates in the grade book, for some reason, this question, and I'm going to talk to the curriculum team tomorrow, this question will give like partial credit, right? There's 3 right answers here. If you got 1, it gives you like 0.33. If you got 2 right, it gives you 0.66. For purposes of these quizzes, there's no partial credit. So I had to go in and back that question out to 0 if you didn't get all 3. So if your grade came up as a 8.33, it's now an 8. If your grade came up a 7.66, it's now a 7. Okay. So I need to figure this out, but what are the 3 correct answers we went through vulnerable populations last week. What are the 3 correct answers?
Is it
2, 3, 4.
substance abusers and HIV patients?
Mm-hmm. And who also is a vulnerable population?
Pregnant women?
Pardon me?
Is it pregnant women?
Nope. We'll talk about that in a second, about
The
why
veteran.
veterans are considered vulnerable populations. That's in your notes. Okay. So veterans, substance abusers, and clients with HIV are all vulnerable populations. Okay. Why is A not a vulnerable population?
Because she's not a teen.
It's not an adolescent pregnancy. Adolescent pregnancies are considered at risk or vulnerable. A healthy 26-year-old pregnant woman is not considered vulnerable. Does that make sense? Okay, number 5. Everybody know what the term resiliency means?
Is it A?
Mm-hmm. Right. And why is it A?
Isn't it like when you're educated enough?
Can't speak up, Terry. I can't hear you.
Can you hear me now?
Yeah, a little bit. I can hear birds chirping.
In the building.
It's because not everybody's muted.
Is it when like you're educated enough, like not to like put yourself in certain situations?
Sure. Yes. You're resilient against being vulnerable to certain risks. Right. That's exactly right. Does everybody understand that? Okay, number 6 is a priority question. So what do we think about when we read 6? What do you think about first? Your ABCs, right?
9-year-old complaining at home, not able to participate in physical exercise.
Yep. And why is that the correct answer? Why is number 2 the correct answer?
he might have asthma or something like.
Exactly. These are some of the signs of an impending asthma attack. Okay. All the other ones are important and they have to be dealt with. But the question asks, which students should be cared for first? Okay, number 7, what's the correct answer?
Eggs.
Why?
I put white rice.
I have too much background from Terry. Somebody else tell me why eggs is the correct answer.
They have a good source of iron.
Okay, great. Number 8. We talked about this last week.
Is it remind the child to use the cream on those areas?
Nope. What is this called? What we talked about this last week. What are these potential signs, symptoms of?
Is it? I chose. Is it the first one?
No, nope. The second one is the correct answer. Okay, advise parents to obtain a full medical evaluation. Right, dark discoloration along the neck crease and armpits could be a potential symptom of type 2 diabetes. We talked about that last week. Okay, question 9. Which nursing intervention is priority for a child experiencing developmental delay? What did we talk about last week? That a potential risk factor for developmental delay.
Is it lead exposure?
Yes, it's lead exposure. Yes. Yep, we talked about that last week. And then number 10, nurse notes a child's BMI is in the 90th percentile. Which intervention is appropriate?
Reduce screen time.
Yep, that's correct. Why is D wrong? Recommend 100% fruit juice with and between meals. Why is that wrong?
It's introducing more calories to the child that's BMI is already high.
Exactly. It's all sugar, right? Obviously, A is wrong. As far as referring for urgent medical evaluation, it's not urgent. I mean, it's important, but it's not urgent. But encouraging parents to reduce screen time, because what happens with the increased screen time? Lack of exercise, right? Okay. Does that help going through that? Okay. Okay. So I'm gonna, the other thing I want to bring up is your HESI prep assignment. You should be filling this out weekly after class. You know, if I give you, 20, 25 minutes off at the end of class, maybe you take a moment to fill this out and fill in the boxes that we covered. There's a lot of things on here we've already covered. Okay. So make sure you keep that handy. Eventually this gets turned in, I think, for like a small grade, but eventually this gets turned in, I think week 11, maybe. I'd have to check the module, but yeah, this eventually gets checked in. So, or turned in, for now, maybe if you're just going through it, maybe you just want to put the week. We covered anthrax in week 6. But as far as turning it in, eventually it's going to have some additional information in it. So it's going to be kind of hard to go back and fill this out, or it's going to be time consuming. You're filling it out in week 10. So I just bring that up. And then we're going to go back and forth between notes and our information, our reading sheets. Okay, so we're going to talk about migrant farm workers first. Anybody have any experience with agricultural workers, migrant farm workers? What do we know about it? Sorry, this is from a student. Hang on. Okay, what do we know about migrant farm workers? Do we think they're at risk for health issues? And why? What are migrant farm workers? Migrant and seasonal workers, what are they?
There are people that come to the U.S. to find work, and then they work, and then they go back home.
Okay. Yep. What kinds of health issues might they face? Health risks, health issues? What's going on in farming?
They deal with a lot of chemicals, so they might have like reactions from like mold and lead and
Pesticides is big.
yeah.
Yep. Accidents from equipment. What if they have their families with them? How do you keep the kids healthy?
Out in the sun, the kids be in the sun.
Okay, so this is your reading for this week. So let's go through this page and then we'll skip over the notes and go through the section in your notes and try and keep it, or I'll try and stay as organized as possible for you. Okay, so like you said, seasonal. These are seasonal employees. Okay. They estimate that there's 1 to 3 million seasonal migrant workers per year. Okay, no Census Bureau data available. Okay, approximately 16% are migrant workers and 84% are seasonal farm workers. Right, both of these populations are predominantly Hispanic, Latino. A large majority of Hispanic, Latino farm workers were born in Mexico. They also include white, African American, Haitian, and Asian people as well. Okay, the average farm worker is 38 years old. And just under half, about 49% of all farm workers in the US are unauthorized workers. So might they be a little reluctant to seek healthcare for fear of immigration issues, deportation? Okay, so what are some of the most common health concerns specific to migrant farm workers and their families? Okay, well, we know that working on the farm is intense, demanding, really poor, sometimes really poor conditions. Okay, specifically heat-related illnesses, right? They're out in the field all day. Exposure to pesticides, chemicals, like we already talked about. Okay, that's kind of the big one. Exposure to pesticides is the primary concern. They also may have injuries from equipment or tools they're using. Urinary tract infections and other infections, right? The lack of cleanliness, poor toilet facilities, animal bites, right? Rodents, insects, snakes. And then they're certainly at higher susceptibility to infectious disease, especially TB. Why? substandard living conditions, living in close quarters with lots of people. And that also is in combination of having barriers to accessing healthcare. Mental health and depression, mental health issues are significant. Okay. Constant relocation. Typically, migrant farm workers are living in poverty, have a lot of stress. They might have their family with them. Okay. Some barriers. Here's some barriers that prevent rural migrant farm workers from receiving health care or healthcare coverage. All right. They can't afford it. There may be in rural areas, we'll cover that next, but there's a lack of services. I mean, you may not even have a primary care in the rural areas. You may have a family doc that does everything. Right? There may be a language barrier. They don't understand how to communicate their issues. They may not understand anything about insurance and may not know what's available to them, or if they're even eligible. And typically, they don't get the retirement package and the healthcare and the dental. And so if they miss a day, they don't get paid. Okay, social isolation and exclusion, that's big. And then lastly, for undocumented workers, fear of their immigration status will affect eligibility. All right, so the frequent relocation involved with migrant workers creates lots of challenges. All right, lots of challenges to help them treat diseases or even diagnose diseases. Yeah, so seasonal workers really have a barrier to seeking basic preventative care and eating for the kids, right? So it puts them at higher risk for other preventable conditions, and by the time they're actually seen, it kind of probably in the advanced, whether it's diabetes or cancer. Okay. Let me cover rural next, and then we'll go back because they're lumped in together in the notes. What do we know about rural populations? There's a lot of similarities between migrant farm workers and rural populations because a lot of these areas they work in are in the rural areas. What do we know about rural populations? What's rural?
It's like isolated areas that don't have the like the ability or the advanced technology like we do, like able to go to the doctors and go to the grocery store and get good foods and stuff. They're rural. They in a designated area.
Yep. Okay, we know that access to healthcare is critical, right, to good health, yet rural residents face a variety of access access barriers. Okay. Ideally, residents should be able to conveniently and confidently access services, right? We want them to be able to access primary care, dental care, behavioral health, emergency services, and public health services. Okay, why do we want, this is really for general populations, right? That is all good for overall physical, social, and mental health status, right? Disease prevention, detection, diagnosis, treatment, quality of life, trying to avoid preventable deaths and life expectancy, right? So that's for everybody. We should be able to all conveniently and confidently access all those services, primary, dental, behavioral. However, rural residents often encounter lots of barriers in trying to obtain the care they need. Right? There aren't a lot of services for rural clients, right? Here's some barriers. They have to have the financial means to pay for services such as health and dental. Okay. They have to have a means to reach the services. There's always transportation issues. Transportation is a big issue in rural. Okay. If they have to see a specialty physician, they may be located in the next big city. Right? Can they take time off? Again, we're back to the issue of no paid time off, no sick time. Next, similar to migrant farm workers, is communication or lack of language barriers. If the client isn't fluent in English or has poor health literacy, that's also a barrier. And what this next one is pretty big in the rural community as far as issues, trust, that they can use services without compromising privacy. What happens in the rural communities is the lack of anonymity. Okay, in small towns, everybody knows everybody. Okay, so we find that the more severe issues like abuse, domestic violence, sexual abuse, substance abuse, a lot of people don't want to seek services for those because they're afraid everybody will find out. So that's a big issue. Some of the barriers we just talked about, but we didn't talk about this one, including workforce shortages, vacant staff positions, right? It's really hard to recruit to work in the rural areas. Doctors, nurses, really hard. Okay, think about a community nurse in the rural community. You know, if you're working in a big city in a public health department, you probably have all these departments: immunization department, communicable disease department, new family department. But in the rural community, you again, kind of like your community nursing that I said in week 1, where you have to bring all your tools in your toolbox. Think about being the rural nurse in a community, and maybe you're covering 2 neighboring communities. You have to be prepared for anything. You may be caring for an infant, you may be caring for an elderly person, right? You may be doing hospice care, you may be doing pediatric care. Okay, so recruiting in the rural communities is difficult. And then we talked about transportation, potential issues with health literacy. And then we all know there's stigma surrounding rural communities. They're kind of labeled for their substance abuse or mental health issues. Well, that's a pretty big issue in rural communities. And I had to, quick example, about a month ago, I had to go to, I'm way up in northern Wisconsin, northwest Wisconsin, in a very rural community. So I'm kind of experiencing this firsthand, but a month ago I had to go to the local police station to get some fingerprints because I needed to apply for a Pennsylvania nursing license, because some of the students I have this term are from Pennsylvania and they're not part of the compact. Anyway, went to the police station. It was probably, I don't know, 800 square feet. I had to ring a doorbell and nobody was there, but somebody drove back. One of the officers drove back. So as they were doing fingerprints, I was asking them, I said, you know, I teach community and public health. What are your biggest issues up here in the rural community? And sure enough, mental health and substance abuse were the first 2 things they said. So anyway, we had a good discussion, but everything that we teach about rural communities, these 2 officers really kind of validated. Then there's some good resources here. Rural public health agencies. I remember last year I had to go find a COVID test because I was traveling overseas to visit my daughter, and I couldn't find, of the 3 local health departments way up where I am, number one, nobody answered the phone. And so the nearest place I could find to go get a COVID test was an hour away. I had to go all the way to Eau Claire, which was an hour and a half away, just to get a COVID test. So anyway, then you can read the rest of this. We've gone over, remember, I just want to make sure you guys understand. Remember, for the exams, okay, it's not just what I go over, because I'm skipping through things. Okay, you are responsible for these pages. Okay, these pages coincide with your notes. Okay, so don't just review what I go over because I skip through things. You're responsible for all of this. Okay, so what we've kind of discussed, distance and transportation for services. Let's say you have a high-risk OB or a cancer that needs radiation, chemo. That's not going to be available in the rural community. Okay, we talked about workforce shortages, really difficult to recruit. Look at this map. Health professional shortages in areas. I'm way up here where that's where I am. Is that Wisconsin? No, that's Minnesota. I'm way up here. And so there's not much up here. Not much at all up here. Okay, but look at all that blue. Look at all that purple. That's a lot of vacancies. That's a lot of shortages. And when you have shortages, that translates into services. Okay. Health insurance coverage, you guys can read through this, but health insurance plays a big factor to access. Okay. Certainly the Affordable Care Act several years ago helped, especially in the rural communities. Okay. The other issue is internet access, broadband access. I mean, sometimes I have a heck of a time up here with internet. I mean, I've got CenturyLink, but a lot of times it kicks off. It makes me nuts, but that's an issue in the rural communities, is consistent broadband access. And then poor health literacy. What's the difference? What do I mean when I say poor health literacy? What does that mean?
Is that when the like proper health education or not
Understanding?
Understanding of proper health, and
Right.
they don't have the access to even get it.
Well, and if you don't even know the language, how do you understand what healthcare providers are telling you? And what if you don't have, in the cities and the hospitals, we have interpreters for every language. They don't have that in the rural areas. Right? So that's a huge barrier, is understanding. How do you give them discharge instructions? How do you talk about treatment plans? Right? The other issue in rural communities is it's factual, but there's a lower education level. Right? And higher incidence of poverty. Right? And when you have low health literacy, clients may be reluctant to seek care because they don't even understand what you're telling them. And then if there's poor health literacy, how are they supposed to navigate the healthcare system? Make appointments, get to appointments, understand anything. And then social stigma, privacy issues. We talked about this. Little autonomy, social stigma, privacy concerns, that really acts like barriers, right? You may not see a domestic violence victim until they're have to show up at the ER. You may not see people with significant substance abuse and addictions until you see them in the ER. Okay, so read through that section as well. Why is primary care important for rural residents? Well, right, primary care is the most basic, along with emergency and public health services, right? Vital need for everybody, okay, especially in the rural communities, right? So if you can get primary care services in the rural community, primary care can offer a wide range, but your primary care may, like I said, may be taking care of infants, adolescents, kids, adults, elderly, disabled, compromised. Okay, we know that primary care is your first point of entry, right? We know that. Okay. And some benefits, we need to know this here, some benefits of primary care. We need to know these 5 bullets: early detection, care coordination, maybe it lowers mortality rates, reduction in low birth weight, and improved healthy behaviors. Okay. And then here's some services that are difficult to access in rural areas. Home health. I want you to read through this section. Home health, because people have to drive. It's hard to recruit for home health in rural areas, right? Home health is face-to-face. What if you have homebound clients in rural areas? Workforce, what if you have a shortage? What if you have vacancies? Right? Time and resources required to get to patients. Okay. A lot of discharge referral difficulties. You know, if you go down to, for me where I am, if I go down to Eau Claire for let's say Tom has a stroke and he needs referral services when we get back up north. Not a lot of services up here. So that can be challenging. And same with hospice and palliative care. Okay, similar to home health issues. Workforce shortages, recruitment, limited access to the internet. And then mental health services, very limited in the rural areas, which actually need it the most. Because that's one of their biggest issues in rural areas is mental health issues. Confirmed by the police officers that did my fingerprints. They said that mental health is the biggest challenge for them up here and in rural America. Very, very limited, right? So again, primary care docs are having to fill in those gaps. They're not only caring for physical issues, but they're also caring for mental health. Okay. In this article, they refer from March 2021, 58% of mental health professional shortage areas were located in rural areas. That's not a lot of services. Look at this. Look at this. Okay. What do these people do? What do these people do? Okay. And then we're under the topic of what are services that are hard to obtain. Substance abuse services. There isn't any rehabs and there isn't any of that up here. Okay. You'll have to travel down to the cities, right? Obviously, if you need detox or rehab, it's not up here. Okay, which then think of all your barriers. How do you get there? How do you pay for it? How do you access it? Okay. There's a lot of organizations that work to provide help vulnerable populations in the rural communities access these services. And here's a few of them. And then OB and maternal health. What if you have a high risk pregnancy? What if there's an emergency? Okay. This is a really good case study here. Models for success in rural maternity care. Okay. And then oral health services is an issue. Dental care. Same article, March 21, 63% of dental shortages, dental health professional shortages were in rural areas, 63%. That's a lot. And then rural health facilities that close, right? Just limits the places and access that services that you have, right? You have to travel to the next town.
If they have all these issues in the rural areas, why don't they not like close them down, but do
What are you
something
gonna
to better it?
What are you gonna move all the rural people to the cities?
I guess if they have this many issues.
But what if they have a farm? What if their business is up here? What if their livelihoods are up here? I mean, I'm surrounded by farms. I have to drive 25 minutes to get to a grocery store.
I was thinking about that too, because like I could, when you travel or something, or you going somewhere and you just see one house in the middle of like a field and there's nothing around. I always thought like, man, where they go to the doctor?
Exactly.
How they get food?
I live in Colorado. I'm from Colorado, and Tom and I are up here in Wisconsin. We have a lake house up here, and so I'm heading home Thursday, I think, for a couple of weeks to Colorado for some stuff. So I'll be back in the cities at the end of the week and have some doctor's appointments. But my point is, you can't get any of that up here. Nothing. So it's challenging. It's really challenging. And so when we talk about, rural health is community health, right? The public health departments up here are one person operating shows. Like I said last year when I was trying to call the 3 different county we're surrounded by 3 different counties. Tried to call all 3 health departments. Not even an answer. Couldn't even get somebody to answer the phone to find out where can I go get a COVID test. Had to drive all the way to Eau Claire for a COVID test. It's crazy, which you can understand why one of the biggest issues in rural health is chronic diseases, right? Because they weren't diagnosed early, or advanced stage diseases, lack of services. So anyway, it's pretty, and when you live it, I'm seeing all this in firsthand. And then I want you to read through some strategies to improve access. Okay. And there's lots of strategies. I mean, Daria, there's lots of organizations. It is very known about the rural health issues. And there's lots of things being worked on to improve everything for the rural communities. Okay, and here's some new delivery models that are being developed. Okay, this is a big one that's starting to really take effect, is affiliating with the larger systems, right? So if a local hospital here, that has maybe 6 beds, maybe affiliated with the bigger hospital in Eau Claire, that maybe they can send somebody up to pick up and do transportation. So all those partnerships are being, they're in the works, and they are in the works. I mean, I kind of make it sound kind of isolated, but it is kind of isolated up here, which is nice if you're healthy, and efforts to improve recruitment. Okay. I made a visit to a local ER a couple of weeks ago with Tom. And I told him I was a nurse, whatever. They were trying to recruit me to come work at their hospital when I wasn't teaching because they were so short-staffed. They said, what can you do? Can you teach CPR? Can you teach our education classes? Can I have your number? We want to give you our number to the head nurse, but yeah, it's just hard to recruit. Telehealth has become big, right? Telehealth. Everybody knows what that is. Who hasn't done a telehealth visit in the last 2 years? I have. I've done a lot of them. Right? Telehealth, it's video calling with your doctor. What happened during the pandemic when everything was closed? Telehealth and video visits became huge. Okay, and there's a couple of other sections in here. I want to move on because I want to get to the notes and see what we haven't covered. Okay, so read the rest of that, please. Okay, so we've covered a lot of this, but there are a few things in here that I want to mention. Some other statistics about rural areas. Interestingly, there's a higher proportion of residents younger than 18 and older than 65. Less education. And interesting, 25% of rural Americans live in poverty. Okay, and 40% of rural kids are in poverty. Okay, most of the rural population that's in poverty are racial and ethnic minorities, and then single parent families, and especially single parent families headed by females. And we know the lack of insurance. Okay, and we've talked about this. Rural adults are less likely to prioritize their health care, especially preventative activities. They're more likely to smoke, alcohol and drug abuse. Obesity is a huge problem. Okay, kids are less likely to get to screening visits, wellness visits, and so are adults, right? So they develop chronic diseases, heart disease, COPD, diabetes. And interestingly, 50% of all rural adults have been diagnosed with at least one of the chronic diseases versus 25% in a non-rural area. That's huge. Higher infant morbidity rates, right? Especially when there's poor coverage. And we talked about this lack specialty, pediatrics, OB. And here I highlighted some of these. This we need to know. What are the 4 primary industries in the rural area that are high risk? Okay, I've highlighted that for you. Forestry, mining, marine-related fields, and agriculture. And you can read through why they are at risk. The biggest, and we're kind of doing rural farm worker here together, but the biggest risk to farm workers, like I said at the beginning, there are a lot of risks, but the biggest risk is pesticide exposure. And here's a good definition of what pesticide exposure is and what it can cause. So we need to know that. Farm workers, female migrant farm workers have a very high risk of sexual harassment and abuse. We talked about often the farm workers have very substandard conditions, at risk for diabetes, poor dental health. We went through that. Okay, so we've covered that. So any questions about migrant and rural? I want to cover poverty and homelessness. I promise my goal is to have you guys to be done by, what time is it? 10:08. So my goal is to be done in 20, 25 minutes. Fair? Okay. So let's go back and cover that. So these are your last two sheets are on homelessness and poverty. Okay, so what do you guys think when you drive down the street or walk down the street and see a big homeless encampment? Are you judgmental? Do you kind of think that, how did we get here? It's hard. It's really hard. And homelessness is increasing so dramatically now in our country. I saw it over the last 2 years in school nursing. The amount of families that lost their jobs, parents who had to stay home to remote, when their kids were remote. I saw a dramatic shift in increase in homeless families. Okay. And we know that homelessness affects everybody, men, women, children, all races, ethnicities, jobs, stature. It affects everybody. On any given night, more than 610, the estimate is, people living in the United States are homeless. And more than a third of that are families. All right, so think about this as a vulnerable population as well. They're more likely to become ill, have greater hospitalization rates because homeless people don't seek primary care. You don't normally see them until they show up in the hospitals. And then their lifespan 42 to 52 years old. We know that kids are much sicker. They don't get to their appointments. They have more infections. They are not screened. They have academic issues, behavioral problems. Obviously, homeless has insufficient funds, can't afford housing, obviously, which is why they're homeless. Also, very prevalent in the homeless population is psychiatric mental health disorders, which is exacerbated by drug and alcohol abuse. And then you combine that with economic issues, social issues, and it's just misery. Okay. The great news is that there's so many healthcare teams working with the homeless. I mean, God bless these groups that are out on the streets working with homeless, screening them in their tents, providing appointments and resources and care they need. Okay. So multi-healthcare team with an outreach focus along with local and state resources and agencies are really trying to help improve the quality of care, to try and help these clients and families be self-sufficient and try and help them succeed. There's a lot of homeless people that never expected to be homeless. They don't want to be homeless. Okay. We define homeless people are individuals without permanent housing who may live on the streets, or they may live in a shelter, or they may live with a relatives. That's considered, they're kind of transient, living with relatives or friends' homes. We had a lot of families in that situation. They're considered homeless. Okay. Demographics of homelessness. Everybody. Approximately 3 million people, 1% of the population is homeless in any given year. Right. And over the past couple of decades, homelessness has skyrocketed. Right. Some risk factors. They have chronic illnesses. Okay. They have substance abuse issues. They have mental illnesses. Compare with the general population, homeless people are 6 times more likely to become sick. Hospitalization rates are 4 times higher. What causes it? Lots of things. Disability is often the result of medical and psychiatric conditions. They can't get a job, just perpetuates a life of homelessness. Estimated that 37% of homeless people have some kind of disability. And then obviously we know that homelessness has huge negative impacts on kids. Infants born into homeless moms, low birth weight, much sicker, asthma, iron deficiency, lead poisoning, respiratory infections, all common with homeless kids. Right? They're much more likely to experience delayed development in school, have growth and development issues, and learning disabilities. And for the kids, they're much more likely to experience poor nutrition, hunger, abuse, neglect, separation from family. And then this is important, your initial approach. What do you think the most important thing is when you're working with the homeless population? What must you develop early on with this group?
Like trust or something?
Trust, respect. You know, they don't want to be there. They don't want to be in this situation. Okay. So this talks about the initial visit, right? Demonstrating interest, demonstrating empathy, compassion, being non-judgmental. Right? Obviously, the goal is to address their health issues, right? Because that's what you're trying to do, is get them to a clinic or get them to a hospital. Okay, but you have to establish mutual trust. Otherwise, they're not going to buy into what you're asking them to do. Okay, and then once you've developed a good rapport with the families, then you can start discussing what the issues are and what resources they need. Okay. We do know that homeless people tend to have the same medical conditions of the general population. However, the difference is they experience long-term exposure to disease, overcrowding, unsanitary conditions, poor nutrition, sleep deprivation. Violence is big with the homeless population. Physical and emotional trauma, sexual abuse is very prevalent in the homeless population. And of course, weather extremes. Limited education, substance abuse. And then here are, I'm going to have you read through these, but here are some common health issues for the homeless: cardiovascular. There are dual diagnosis of mental illness along with substance abuse. Lots of homeless people have TBIs, cognitive disorders, and injuries and violence is very prevalent. So again, I'm going to have you read through that. Infectious diseases, sexually transmitted infections, skin and foot problems, lice, scabies, secondary bacterial infections. That's endemic. What does endemic mean? Ongoing in the hospital population because of poor living conditions. And then exposure issues, cold, heat. And then we talked about this, what are some of the best models for care? Integrated team, multidisciplinary approach. Okay. And hopefully by people that have a unique knowledge base about the challenges that homeless people face. Okay. We might as well talk about our last page, poverty, before we go to the last part of the notes, which combines the two of them. Poverty. The amount of individuals, families in poverty, living in poverty, is skyrocketing. Absolutely skyrocketing, especially over the last couple of years with the pandemic. Okay. The beginning of this is just a lot of statistics. Geography of poverty, right? So we do know that people, poverty tends to be clustered in geographic areas. Okay, certain regions, certain counties, certain neighborhoods, then being spread all across the nation. Right, so research has shown that poor living conditions in areas where poverty is prevalent face barriers, lots of barriers. Okay, concentrated areas that have high rates of poverty, that leads to poor housing, poor health, higher crime, higher dropout rates, unemployment. Right, so as a result, if the conditions are very poor, it creates limited opportunities for poor residents. And it just becomes self-perpetuating, generational poverty, they call it. Okay. Oops. Typically, non-metro counties with a high incidence of poverty are mainly concentrated in the South. Okay, and it goes through describing some areas in the South where there's some geographic locations. So you can read through that. And then it talks about an important dimension of poverty is its persistence over time. Okay, a lot of people over the last 2 years didn't expect to be living below the poverty line. And they are there now. And if you're in community nursing, at least for me, being in the schools for the last couple of years, it was beyond obvious. Okay. And here's some demographics. Areas with high incidence of poverty often reflect the low income of their racial ethnic minorities. Okay, non-metro, so non-metro Blacks, African Americans had the highest incidence of poverty in 2019, 30.7%. So there's a graphic on that. Poverty rates by families, poverty rates by age group, really interesting visuals. And then it goes through how is poverty defined. Okay, so there's a lot of people living below the poverty line, but there's a lot of people right at it or slightly above it. And they might as well be living in poverty with poverty risks as well. Okay. So let's cover this last part of poverty and homelessness. And this addresses COVID. Before COVID, the percentage of Americans living in poverty, interestingly enough, was the lowest it's been since 1959 at 10%. After COVID, it climbed to 17. Okay, more than 48 million Americans were living in poverty. And the child poverty rate skyrocketed to about 5 million. Okay, and this next section goes through how do you federally qualify for being living in poverty? And it goes through some numbers. And so what does poverty mean? Obviously, it means having insufficient resources to meet your needs. Housing needs, food, shelter, food, transportation, healthcare. Okay. What contributes to poverty? Unemployment. loss of retirement benefits when a company closes or files for bankruptcy. Poverty's increased with female head households. Inadequate education job training. Weak enforcement of child support statutes. That's big. Outsourcing of American jobs. Poverty leads to chronic stress, leads to mental health issues, high rate of chronic illness, higher infant morbidity and mortality rates, shorter life expectancy, more complex health problems, and then higher disability rates related to chronic illness. And that results in higher rates of hospitalizations. Okay. What if you're living in poverty and you have complex medical needs, or you have a one-off event? How do you handle that? Okay. Living in poverty usually means that you don't have the ability to pay for health care. In fact, you may not even have insurance. And what if you're sorry, excuse me. Low-paying jobs often don't provide health insurance. Then women of childbearing age often suffer greatly living in poverty. Diabetes, hypertension, obesity, asthma, right? This can all lead to pregnancy complications. And then kids. Young children are the highest risk for the effects of poverty. Okay, lack of adequate nutrition, poor brain development, exposure to toxins, trauma, abuse, and just a lower quality of care. The more they have chronic conditions, nutritional deficiencies, growth and development issues, higher incidence of lead levels, more infections. They're usually stuck in the poverty cycle themselves due to decreased opportunities. Now, what about teens? Teens are more likely to have below average academic skills, 3 times more likely to drop out of school, higher rates of pregnancy, teen pregnancy, and more likely to suffer complications with pregnancy, right? Lack of prenatal care, really maybe lack of acknowledgement they're even pregnant. Low birth weight kids, preemies. I think we've covered quite a bit of this in the homeless section of your notes. Substance abuse, domestic violence, definition of homelessness. So let's finish up by, as nurses, it's vital that we respect the individuality of every person, right? Many factors contribute to whatever, homelessness, poverty, and many of us are 1 or 2 paychecks of being unable to maintain our daily standard of living. Right, Tasha? Tasha's shaking her head. Yeah. Yeah. It's easy to stereotype, but often we're wrong. If we stereotype and be judgmental, we're putting the development of relationships with these families at risk. Right? You can't make assumptions. Let them tell their story. I'm talking about all these vulnerable populations that were talked about today. Homelessness, poverty, rural patients with their stigmas, migrants, undocumented workers. Let them tell their story, learn who they are, get to know them. We probably know 2% of what's going on. Take the time to learn. These are really, really vulnerable populations. So what would be some, let's talk about primary, secondary, and tertiary. with regards to all these groups, because there are questions on the exam that are related to primary, secondary, and tertiary. So what's primary? Let's just go through what's primary. P is for what?
Preventative.
S is for what? Secondary. S is for what? Screening. And then T, tertiary, is for what? Treatment.
Treatment.
Okay, so primary prevention. Okay, so here's an example for farm workers. Teach ways to avoid pesticide exposure on the farm. Right? Maybe advocate for childhood immunizations in migrant farm workers. Advocate for better living conditions because they're at higher risk for TB. Do everybody understand why those three examples are primary? Okay, secondary, screening. Maybe we're screening for evidence of financial instability. Okay, especially those with chronic illnesses. Screening yearly blood pressure checks. Maybe you're doing mammograms, pap smears. What are we trying to do? TB skin testing, HIV screenings. What are we trying to do? Secondary, even though we're doing the screening, why are we doing the screening? Early identification and means early intervention. Okay, so we're screening for risk. And then what happens in tertiary? They already have the disease, they already have the condition, right? So we're helping them manage it. We're treating it, helping them manage it. So here's some examples: providing guidance on non-pharmacological management of back pain. So they already have the lower back pain. Helping a homeless client find and apply for resources. They're already homeless. Referring to the health department for treatment of HIV or STDs. They already have STD or HIV. Teaching a client how to take medications. They already have a condition that's requiring them to take medications. Okay. Does everybody understand why those are primary, secondary, tertiary? It's critical to moving through this class. And the expectation is that a couple of things with your ADPI, right? You guys all know what ADPI is, right? The expectation is that you should be able to take your ADPI, let's say from doing an assessment of a pediatric patient in a hospital. You do your ADPI, right? You need to be able to think ADPI in the community. So what if you're think of ADPI with your patient and the pediatric unit in your clinical versus ADPI when you're doing a home visit to a family and doing an assessment. So how does your assessment differ from your patient in the hospital to your family in the home? How does your planning? Okay, so ADPI is applied to community health. ADPI is your nursing process. It applies to every area of nursing. The difference is you have to be able to apply it to different settings. Make sense? Same with primary, secondary, and tertiary. Okay, there's a standard definition for each, but you have to be able to apply it to your pediatric patient you've just admitted that has asthma. Okay, you have to apply what you would do with tertiary prevention with that versus doing a home visit to help teach parents how to help their kid use their inhaler. Okay, my point is you have to be able to take those two important things, your ADPI and your 3 prevention levels, and apply it to the community setting. Okay. So that's where we're at. these are hard. These are hard topics to cover. They really are. There's a lot of people in need, a lot of vulnerable people, a lot of vulnerable families. And whatever type of nursing you work in, you're not going to avoid it. You're going to be working with these people or families or all the time. So anyway, any questions? Was that helpful? Was that interesting information? Did you learn a lot?
Yes, I mean, you already know, we kind of can see the situation going on.
Mhm.
'Cause if you ride up the streets, you just see it. We went to Texas, was it last year? Around about, I can't remember when, but we maybe it was cold season, but we rode down the street, and I'm talking about, it was just rows and rows and lines of like people living out there, you know, families. I'm talking about the whole 9 yards. It's just a sad situation.
Yeah. Yeah. And I'm sure, do you guys notice these vulnerable populations in your community? Probably primarily homeless. So this is what that vulnerable population assignment is all about in week 10, is picking a population in your community and studying it more and understanding it more fully. So, but these are, if you're in community nursing, you're working with vulnerable populations day in and day out. And if you're in rural community nursing, it's even more challenging. So, okay, any questions? That's it for me. I want to give you guys a little bit of a break before you go to your med surge class. I will stay on. If anybody has any questions, you guys know how to reach me if you need anything. I hope to have you groups, study guide, review sessions, and finish my grading, hopefully today. And by the way, you guys, the ones I've looked at, your discussion questions about the common childhood ailments are awesome. You guys did a fabulous job. So, I mean, are you, my last question, are you learning that community nursing is really a big scope of practice? Huge scope of practice. And so when I said in week 1, you got to bring all your tools in your toolbox, I wasn't kidding. Mental health, peds, OB, leadership, fundamentals, everything. So, well, I hope you guys have a really good rest of the week. You know where to find me if you need me. Please reach out for anything. I'm traveling, I think, on Thursday, but short flight, no big deal. So I can respond to anything in between. So have a good week. And we'll see you guys next week for the exam. Oh, well, actually, take that back. I hope to see all of you in a review session. And you do know, right, that attending a live review session is directly related to higher exam grades. Just throwing that out there. And I don't do extra exam reviews on Fridays and Saturdays for me. I do it for you. Okay, so I want to tie everything together so that you're well prepared going into the exam. Because doing well in exam 1 is important, because you don't want to be behind the 8 ball the whole class. You're just playing catch up. So I implore you, if you can, get to one of the reviews. And then if you can't, plan B would be to at least watch the recordings. Or, I mean, it'll be the same review, so watch the recording. But yeah, so I'm going to try and pull everything together on the study guide. Okay, so look for that in the next couple of days. Okie dokie. Okay, have a good week. Stay on if you need anything. Okay,
Thank
bye.
you.
You're welcome. Bye.
For, will you be posting like the times for the